We're back. This is Health This Week. I'm Don Baillargeon, and I'm joined in studio now by Dr. Sheila Forman, great friend of the program. Sheila, always great to see you.
Thanks very much, Don.
Well, Sheila, there was a study that came out this week that I really wanted to talk to you about because it said that men are at greater risk of dying of cancer, and the reason was very surprising to me, although it shouldn't be. It's because we're stubborn. We don't like to go to the doctor.
That's right.
Why is it that, I mean, I'm one of these guys. Something goes wrong, well, I'm going to tough it out. I'm going to get through it. I don't feel like going to the doctor. What is it, the whole deal?
You know, and I wish you had the answer, because all us women out there would love to know the answer to why you're so stubborn. But so much of it is men do like to tough it out. They just want to be brave and march forward. And that's okay, and you don't want to make a man wrong for that, but you also want to encourage him to have all the facts before he moves forward into a decision, either to do or to not do something.
And I'll be very honest with you. With me, I don't look at it so much as toughing it out, but I'm looking at, okay, I've got to go over to the doctor. I've got to sit in the waiting room. I've got to sit in the examination room. Then I've got to do this, and I've got to do that. And the whole process seems to take an entire day. It feels like it. To find out, yeah, take 2 aspirin and call me in the morning. That's kind of how we feel it's gonna end up.
Mm-hmm. And we hope that that is the ending, that you waste a whole day to find out all you need is 2 aspirins. But part of it is really a cost and benefit analysis. It's going to cost you the whole day, and you don't want to give up your whole day. But what are you going to get? If you're going to get your health, if you're going to get your proper diagnosis, if you're going to get a treatment plan that's going to allow you to live the rest of your life, isn't it worth a day?
Sure.
So you have to balance it.
Now, of course, here in the 21st century, we have this little thing called the internet, where we can go online and type in symptoms at various websites and kind of self-diagnose what our problems might be. But, you know, we're not physicians. We might get it wrong.
Well, you might get it wrong. You also might scare yourself unnecessarily. I mean, there's wonderful reasons to use the internet to get information, but I also have worked with many patients who get so obsessed when they get a diagnosis or they fear they have a diagnosis that they get locked into the internet, and you hear all the horror stories, all the what might not happen but could happen kind of scenarios, and that's dangerous. You need to use the internet cautiously and effectively.
You know, we were joking before going on the air where, you know, men don't like to go to the doctor, men don't like to ask for directions, but what it comes down to is if you're feeling some kind of symptom that to you feels unusual, and especially if we're talking about cancer, that was the focus of this study that we're chatting about, it's so important to catch something like that in the very early stages.
Sometimes the resistance is about control. I want to be in control. The man wants to be in control of his life. Well, when you think that going to the doctor, getting information allows you to be in control, then maybe you're more likely to go.
It's a good way to look at it.
You're not giving up control. You're gaining information. You're taking control.
Well, you're precisely right, because that's the first thing that comes to mind is, you know, you're going to give up a whole day. All this time that's wasted, and you feel like you're losing control. So the way to focus on this is to think, okay, I'm controlling my health output by taking these positive steps.
Exactly.
That's a different way to think about it.
And hopefully one that will help men get to the doctor's office sooner rather than later. Women tend to have a more of a health consciousness, and as men develop a more health consciousness, I think they would have a willingness to go to the doctor, get the information, and that use it to their advantage.
Well, let's face it, you only have to be married for a few years to realize that women are more smarter than men. We like to think it's just the opposite, but we figure that out very, very quickly. In your practice, do you encounter men with this stubbornness to seek medical attention when they might possibly need it?
Oh, absolutely, of course, especially if I'm treating someone with depression or anxiety and I want to make a referral for medication. The resistance is unbelievable. But when we talk about the cost and the benefits, when we talk about taking control, kind of reframe it to be very empowering, then they're more likely to go. They don't want to be seen as weak.
Well, it's hard on us, Sheila. First, we have to accept going to the doctor, and we have to ask directions how to get to his office. Once again, Dr. Sheila Forman. If you'd like more information about Sheila, go to her website, drsheilafforman.com. As always, Sheila, thanks so much.
My pleasure.